strengths of the Region's emergency medicine residency is the strength of our simulation program. We have 3 faculty members who are dedicated to spending a lot of their time helping you learn through simulation. We've recently expanded the number of small group days that we do during the course of the regular didactic curriculum to being approximately once a month. We'll go into small groups where you're maybe with 6 or 8 other learners, and you'll be exposed to a patient, and you'll be expected to treat that patient and then get feedback about how your performance was. And the patient that we're talking about in this case obviously is a simulated patient. The advantage to that is that we can recreate some of those rare learning experiences that you might not otherwise encounter until late in your residency or at all.
Your education is a partnership between you and us. You bring your motivation, curiosity, and self-awareness, and we will provide ample opportunities both inside and outside the emergency department to help you become the emergency physician that you want to be.
We believe that this is a far superior way of learning, and base a lot of this on adult learning theory, which basically is saying that having a hands-on active involvement in your learning is better than sitting back and sleeping through 5 hours of continuous lecture.
We understand what you need to be at the end of the 3 years, and if we can't provide the opportunity in a patient in the ED, we'll talk about it in conference, we'll talk about it in small groups, we'll find a way for you to see what you need to see in order to be a well-rounded, excellent emergency physician. Right, big guy?
There's a few things to know during this first year. It is rigorous, but you get a broad exposure. For instance, right now I'm on plastic surgery, so there's a lot of hand cases, which is something really important to know while you're in the emergency room. Other rotations you do are orthopedic surgery, of course, surgical ICU for 6 weeks, and the MICU, as well as a pretty unique experience of working with a palliative care team while you're doing your inpatient hospitalist rotation.
The reason I chose to come here, quite a few reasons. First was their emphasis on critical care. I really like the amount of time that you get to spend up in the ICU.
The SICU is staffed by emergency medicine residents in their first, second, and third year in conjunction with 2 PAs that we have. We work very closely with the emergency medicine residents, obviously, since they are the primary caregivers in the SICU.
I love the way that we do conferences here. They're very interactive. It's not just sit and listen to a lecture for 5 hours.
The didactics and the skills training received here at Regents really served me well. I felt like I could handle things well. I felt like I was efficient. And I think that looking back on the training, it was a very well-rounded experience.
We have our critical case conference where we go through a case, and we're the ones who have to think about what we'd want to do and why we do it and how we do it, and so that provides some really good discussion and helps you think through cases that you may not necessarily have seen that patient, but you still get good learning from that situation.
Things that are great about it, it's kind of a see one, do one, teach one educational atmosphere, which I love.
I've had opportunities to do a lot of procedures that some emergency medicine residents don't get until their second or third year.
There's a wealth of procedures to be performed in the SICU, including chest tubes, central lines. There's also opportunity to utilize ultrasound in the SICU for follow-up abdominal exams as well as procedural adjuncts.
The very first shift you can be doing intubations, doing central lines, things like that, so you just get going from the get-go. There isn't some sort of hierarchy as far as who gets to do what procedure.
I can definitely say that comparing myself to other interns that are about my level of training, I've gotten many more opportunities to do procedures.
We have always been fully accredited through the RRC, and most recently had an accreditation last year with another full 5-year accreditation process.